How to control high blood pressure / or how to manage high blood pressure at home. It is easy to control high blood pressure at home. Here I can suggest some general tips on how to manage and control high blood pressure. Hypertension. Here are some lifestyle changes and strategies that may help you to control hypertension. Monitor your blood pressure. Regularly check your blood pressure at home using a home blood pressure monitor, and record the readings. Share these readings with your healthcare provider. According to this monitoring, you can manage your diet or lifestyle and many other things that keep you active and stay away from hypertension, as it is a complex disease that is very common these days. Healthy diet. Reduce sodium intake. Limit salt and sodium-rich foods in your diet, as they can raise blood pressure. Reducing sodium intake is a key strategy for managing high blood pressure. Excessive salt consumption can cause the body to retain water, leading to higher blood volume and increased pressure on the blood vessel walls. By cutting back on high-sodium foods and opting for a diet rich in fruits, vegetables, and whole grains, individuals with hypertension can help lower their blood pressure and reduce their risk of heart disease and stroke. It's a simple yet effective step towards better cardiovascular health. You should avoid salt in your diet. Eat more fruits and vegetables. Aim for a diet rich in fruits, vegetables, whole grains, and lean proteins. Make your routine to eat fruits and vegetables regularly, like salad juices. Eating a diet rich in fruits and vegetables is an excellent way to lower high blood pressure. These natural foods are packed with essential nutrients like potassium, fiber, and antioxidants, which can help relax blood vessel walls, reduce sodium levels, and improve overall cardiovascular health, which is good for heart health. Incorporating more fruits and vegetables into your diet not only adds flavor and variety but also supports your efforts to manage hypertension and maintain healthy blood pressure levels. It's a delicious and nutritious way to promote heart health. Diet. Consider following the dietary approaches to stop hypertension. Diet, which emphasizes low sodium, high potassium foods. The diet is a proven and well-regarded eating plan designed to lower high blood pressure and promote overall heart health. It emphasizes a balanced intake of fruits, vegetables, whole grains, lean proteins, and low-fat dairy products while limiting saturated fats, cholesterol, and sodium. The diet's focus on nutrient-rich foods and reduced sodium intake helps reduce the risk of hypertension, stroke, and heart disease. It can control easily your uric acid level and cholesterol levels. It's a flexible and sustainable dietary approach that encourages a healthier lifestyle for those looking to manage or prevent high blood pressure. Maintain a healthy weight. Losing excess weight can significantly lower blood pressure. Even losing a small amount of weight can make a difference. Maintaining a stable and healthy weight is a vital step in lowering and managing blood pressure. A balanced weight keeps you active and more attractive. By adopting a balanced diet, engaging in regular physical activity, and practicing mindful eating habits, you can help your body achieve and maintain a healthy weight. A stable weight reduces the strain on your cardiovascular system and contributes to better blood pressure control, ultimately promoting overall heart health. A balanced weight keeps you far away from many diseases and saves your life. Exercise regularly. Engage in at least 150 minutes of moderate-intensity aerobic exercise, 75 minutes of vigorous intensity aerobic activity per week, or a combination of both. Take a fixed time for your walk and exercise that opens your blood vessels and increases a better blood circulation to your body. Aerobic exercises, such as brisk walking, jogging, cycling, swimming, and dancing, are particularly effective at controlling blood pressure. These activities increase your heart rate and promote better cardiovascular health. Regular aerobic exercise strengthens the heart, reduces the force on artery walls, and helps your body manage blood pressure more efficiently. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic activity each week to support lower and healthier blood pressure levels. However, it's crucial to consult with a healthcare professional before starting a new exercise program, especially if you have high blood pressure or other underlying health conditions. Limit alcohol. If you drink alcohol, do so in moderation. This typically means up to 1 drink per day for women and up to 2 drinks per day for men. Limiting alcohol consumption is essential for overall health, including the management of blood pressure. Excessive alcohol intake can raise blood pressure, and it can also interfere with the effectiveness of blood pressure medications. To maintain lower and healthier blood pressure levels, it's advisable to follow recommended guidelines, which typically suggest up to 1 drink per day for women and up to 2 drinks per day for men. However, it's important to note that some individuals should avoid alcohol entirely due to their specific health conditions or medications. Quit smoking. Smoking can raise your blood pressure and increase the risk of heart disease. Limiting or quitting smoking is crucial for reducing and managing blood pressure. Smoking tobacco products contain harmful chemicals that can damage blood vessels, raise blood pressure, and increase the risk of heart disease.